So happy to be here. As you know, I am Tanya Cunningham with Tanya Holmes Group at eXp Realty. And this is Dr. Patel, and she is a chiropractor. And she is going to talk to us today a little bit about, how we can really take care of ourselves during this time, especially when a lot of us are at home. And we are stuck at home for many weeks and maybe quite a few more weeks ahead. And Dr. Patel has some insights into how we can take care of ourselves. So, hi, Dr. Patel, how are you?
Hi, Tanya. Thank you. Thank you so much for having me. As a sports chiropractor, I focus a lot on all kinds of musculoskeletal issues, whether it's from headache to turf toe, shin splints, hip pain, shoulder pain. And another complaint that I've been getting is neck pain or upper back pain, and that's because all of us are, on our phone. And so we tend to get into this position where we're kind of slouched and we're sitting in this position, so everything in our neck starts to hurt, and you start to go from shoulders in this position to rounding. So one of the exercises that I really suggest for a lot of my patients is called a chin tuck. And it's kind of like a chicken or a turkey movement, so pretend you're a chicken or you're a turkey while you're doing this, and that's going to help a lot. And the other thing is do it in front of a mirror, or even if you're on your phone, just do it, turn on the camera and do it on your phone. And you're going to start by placing your finger on your chin and just pulling back. There you go. So now one of the things is keep your upper body in the same spot, so don't move your whole body back. And the other thing is when you tuck in and pull back, you're not going to go up and you're not going to go down. A lot of people get confused and they start to move their jaw back, but that's not the exercise. So you want to imagine this is your spine and this is your skull, right? So what you're doing is you're scooping it up. Imagine as if someone's pulling your head with this string and it's going up. So what you're doing is tractioning all these muscles, and you're stretching all these muscles from your mid-back up into your neck. So it's going to look like this. Right? And when you do it, try to hold it for 10 seconds.
Hold it back.
Yeah. So you want to hold it in that position for 10 seconds.
And then come forward.
And then come forward. And you can do that 10 times. The exercise was actually designed as a micro break, so the best time to do it is every hour. And you could do it 3 times, you could do it 10 times, but the goal is to remind yourself to do that exercise and relax, right?
So throughout the day, we can be doing that.
Yeah, especially if you're sitting on your phone or you're on your computer. Even if you're driving, it's a good exercise that I give to my patients who are truck drivers.
I need that.
Yeah. It feels good, and you want to feel like someone's pulling you like a puppet, and so you get that nice stretch down your neck.
Got it.
So there's of course, and there's one more exercise called the micro break or Brugger's exercise. And that one I'm going to stand up. So if you're sitting, you want to bring your elbows or your hands out in front of you, digging my elbows into my side. I'm just rotating my fist out. So if you want to pay attention to my shoulders, this is what happens. I'm in this position, and now you see my shoulders kind of move apart, and it's going to stretch the muscles in here, the pec, and it's going to help prevent you from your shoulders rounding into this forward position and then going out. So let me see you do it.
So I'm here.
Yep.
And I'm opening it up.
Yep.
Like,
so you're squeezing your shoulder blades together in the back, and in the front you're just stretching the glenohumeral joint in the front, the shoulder in the front.
Got it. Yep. Okay. Wow, I feel that. Like you feel that right in the middle of the back. Is that where I'm supposed to be feeling it?
So when you're sitting, your head, it's more than 10 pounds, right? So imagine a bowling ball on this stick, which is your spine. It's the most important part of your body. It's holding your spinal cord, and you want to protect that. So each inch forward that your head goes feels like another 10 pounds of pressure on your spine, and that's your muscles working harder and harder to hold that head in that position, right? So it's when your mid back starts to curve more because your head is going forward, it's going to put strain on those muscles. So that exercise is designed to help you kind of strengthen it back into a neutral position.
Got it. Wow. Okay, great. So we had two really good exercises there that really can help us, because maybe a lot of us now aren't in our cars as much, but we're certainly sitting down and on the computer so much more than we were. And for people like me, I'm a realtor who's always at my computer. This helps you whether you are quarantined or not quarantined,
Right.
and it really helps open you up and get loose, I would think, right?
Yes.
So I know that we're going to be wrapping it up shortly, and just so that you all know out there, Dr. Patel is my chiropractor, and she is amazing, and she really is thorough in the way that she helps you understand your body and works on your body. I was intimidated by chiropractors because I thought all they did was just crack you, and I just can't stand that noise. But it's not like that with Dr. Patel. It's really a great experience, and a lot of the members, even of our business group, go to Dr. Patel because she's so great.
Most of the questions that I get asked is, do I take insurance? I do take most major med. And what kind of conditions do I treat? And like I said, head to toe, most musculoskeletal conditions. And do you need a script or a referral to go see a chiropractor? And the answer is no. In the state of Florida, chiropractors are considered primary care physicians, so they have a pretty big scope. So if I need to send someone for an x-ray or MRI, I can do that as well.
Oh, perfect.
Yes.
Okay, so I think that it would be great if you just tell us once again how to reach you, because after this is over and we can go back to coming out and seeing you physically, a lot of people would love to come and see you, and then in the meantime perhaps they can even call you and consult with you on the phone. So can you tell us your phone number? I will post it below this post, but just tell us right now and how else they can reach you.
Yeah, my phone number for my office is 954-900-2942. You can always call. We do free consultations in the office as well. The best way to reach me directly would be through my social media, which is DRPATEL Therapy. And I also have a YouTube page, like I was saying, where if you want to go and take a sneak peek and look at what type of therapies I do and what it looks like to get treated with me.
Perfect. Thank you so much, Dr. Patel. This was great. I really think that this is information that all of us can use. Many people out there right now are in pain, experiencing pain in their shoulders and backs a lot, and the rest of their body, and they really need guidance on how to get out of that. And now, because they're so confined, it's even harder. So I'm glad that you mentioned your YouTube video, your channel, and that we can get in touch with you. Thank you once again. I'll see you again next week, because I see her every week.
Yes.
And really am excited about that. We do our own Zoom business meeting every Wednesday for BNI, and I'm looking forward to seeing you then. And thank you so much, and I will talk to you soon.
Thank you.